Introduction. Lice are small, wingless parasites that depend on their host's body and feed on human blood. These parasites can cause serious health and social problems. Lice are divided into three main types: head lice, body lice, and pubic lice. Each of these types of lice has its own characteristics, transmission methods, clinical symptoms, and treatment methods. Part 1: Head lice. Morphology and characteristics. Head lice are about 2 to 3 mm in size and are grayish-white in color. Lice eggs are oval-shaped and white, and they cling to the hair shafts close to the scalp. Head lice have the ability to move quickly on the scalp and hair, but they cannot jump or fly. Habitat. This type of lice is mostly found in scalp hair, especially behind the ears and near the neck. Head lice usually cannot survive for long periods outside the host's body due to the need for human body temperature and a food source. Life cycle. The life cycle of head lice consists of 3 stages: egg, nymph, and adult. The eggs, which are attached to the hair, hatch within 7 to 10 days, and the nymphs mature into adult lice after 3 molting stages. Adult head lice can live up to 30 days on the scalp and lay several eggs per day, leading to a rapid increase in their population. Transmission methods. Head lice are transmitted through direct head-to-head contact. They can also be transmitted through shared personal items such as combs, brushes, hats, and pillows. Although transmission through shared items is less common, as lice quickly die when away from the human body. Clinical symptoms. Intense itching of the scalp, usually caused by an allergic reaction to lice saliva, is the most common symptom. Other symptoms may include scratching, secondary skin lesions due to severe itching, a sensation of something moving in the hair, and the presence of lice and their eggs in the hair and scalp. In some cases, swelling and inflammation of the neck lymph nodes may also be observed. Treatment methods. Treatment of head lice includes the use of insecticidal shampoos and lotions such as permethrin, malathion, and ivermectin, which are readily available at pharmacies and are usually applied topically to the hair and scalp. Additionally, combing the hair with fine-toothed combs to remove lice and their eggs is essential. Some home remedies such as tea tree oil, vinegar, and mayonnaise have been suggested, but their effectiveness compared to chemical treatments is lower. Part 2: Body lice. Morphology and characteristics. Body lice are similar to head lice but slightly larger, with sizes ranging from 2.3 to 3.6 mm. Due to their blood feeding, their color is usually grayish-brown. Body lice are mostly found in environments with poor hygiene and close human contact. Habitat. Unlike head lice, body lice live on clothing and bedding and only come to the body for feeding. These lice lay their eggs in the seams and folds of clothing. Body lice can survive for up to a month under suitable conditions, but their survival time decreases outside the host's body and in cold conditions. Life cycle. The life cycle of body lice is similar to that of head lice, except that these lice lay their eggs in the seams and folds of clothing. The eggs hatch within 7 to 10 days, and the nymphs mature into adult lice after 3 molting stages. Each adult louse lays several eggs per day, leading to a rapid increase in the louse population in contaminated environments. Transmission methods. These lice are transmitted through direct contact with contaminated clothing and bedding. Overcrowded and poorly hygienic conditions can contribute to the increased prevalence of this parasite. Environments such as shelters, refugee camps, and war-torn areas where people live closely together are usually prone to body lice infestation. Clinical symptoms. Intense itching of the body, skin lesions in the form of red spots, and skin inflammation are common symptoms. In severe cases, secondary bacterial infections may also occur. Other symptoms include small red and itchy bumps, fatigue, and in rare cases, fever. Itching and skin inflammation are usually due to an allergic reaction to lice saliva. Treatment methods. Treatment of body lice includes thorough washing of the entire body with soap and warm water, washing clothes and bedding in hot water, and the use of appropriate insecticides. Washing and drying clothes at high temperatures can eliminate lice and their eggs. In severe cases, oral medications such as ivermectin may be necessary. Third section, pubic lice. Appearance and characteristics. Pubic lice, also known as crabs, have a rounder and shorter shape. With a size of about 1.5 to 2 mm, they are usually grayish-white in color and, due to their distinctive appearance, are easily distinguishable from head and body lice. Habitat. These lice are mostly found in the pubic area, but they can also infest hair in other parts of the body such as the armpits, chest, eyelashes, and eyebrows. Pubic lice, due to their need for human body temperature and a source of food, usually cannot survive for long periods outside the host's body. Life cycle. The life cycle of pubic lice is similar to that of other lice, with the difference that these lice attach their eggs to the hair in the pubic area. The eggs hatch within 6 to 10 days, and nymphs, after 3 molting stages, develop into adult lice. Each adult louse lays several eggs daily, leading to a rapid increase in the lice population. Transmission methods. Pubic lice are primarily transmitted through sexual contact. Sharing clothes and towels can also contribute to the transmission of these lice, although this method of transmission is less common. Because pubic lice mostly live in the pubic area, they are usually more prevalent in adults. Clinical symptoms. Severe itching in the pubic area, the presence of bluish spots on the skin due to lice bites, and skin inflammation are common symptoms. Itching usually worsens at night and can lead to scratching and secondary infections. In severe cases, skin lesions resembling dermatitis may also be observed. Treatment methods. Treatment of pubic lice involves the use of insecticidal shampoos and lotions such as permethrin and pyrethrin. These products are applied topically to the hair and skin of the pubic area. Additionally, shaving the infested area can help reduce lice. In cases where eyelashes and eyebrows are also infested, the use of specialized eye ointments is recommended. Fourth section, prevention. Preventing infestation with pubic lice is highly important and involves personal and environmental hygiene practices. Some preventive measures include personal hygiene. Avoiding direct contact. Avoiding direct contact with individuals infected with pubic lice, especially in cases of head lice infestation, can reduce the risk of transmission. Not sharing personal items. Avoiding the sharing of personal items such as combs, brushes, hats, helmets, towels, and clothing. Regular body and hair washing. Regular washing of the body and hair with appropriate shampoos and soaps helps maintain hygiene. Regular examination and control. Regular examination and control of hair and skin to identify lice and their eggs, especially in children. Environmental hygiene. Washing clothes and towels. Regular washing of clothes and towels in hot water and drying them at high temperatures can eliminate lice and their eggs. Maintaining cleanliness in the living environment. Maintaining cleanliness in the living environment and avoiding unsanitary conditions, especially in public places such as shelters and camps. Vacuuming. Regular vacuuming of carpets, furniture, and mattresses can help reduce the number of lice in the environment. Education and awareness. Health education. Health education for children and adults about the transmission methods of lice and preventive measures is essential. Public awareness. Increasing community awareness about lice and methods to combat them can help reduce the prevalence of these parasites. Fifth section, advanced treatment methods. Medical treatments. In addition to regular insecticidal shampoos and lotions, some oral and topical medications are used to treat pubic lice. Ivermectin. Ivermectin is used orally or topically to treat pubic and body lice. This medication disrupts the nervous system of lice, leading to their death. Spinosad. Spinosad is a topical insecticide used to treat head lice. It works by affecting the nervous system of lice, causing rapid death. Drug-resistant cases. In some cases, lice may become resistant to certain drugs. In such cases, using a combination of drugs or changing the medication can be effective. Home remedies. Some home remedies are also used to combat pubic lice, although their effectiveness may be lower compared to medical treatments. Tea tree oil. Tea tree oil is used as a home remedy for lice due to its disinfectant and insecticidal properties. Vinegar. Washing hair with vinegar may help loosen lice eggs from the hair, although its effectiveness compared to medical treatments is limited. Mayonnaise and olive oil. These substances can be used to suffocate lice. Hair is covered with mayonnaise or olive oil and then wrapped with plastic wrap for several hours to suffocate the lice. Section 6. Consequences and problems caused by lice. Lice can cause serious health and social problems. Some of the consequences and issues caused by lice include secondary infections. Severe itching and skin scratching can lead to secondary bacterial infections. Swelling and lymph gland inflammation. In some cases, lice can cause swelling and inflammation of the lymph glands. Anxiety and stress. The presence of lice and severe itching can cause significant anxiety and stress. Social problems. Infestation with lice can lead to social problems such as embarrassment and isolation. Section 7. Recent research and studies. Many research studies have been conducted on lice and methods to combat them. Some of the most important recent research includes drug resistance. Studies have shown that lice resistance to certain insecticides such as permethrin is increasing. This necessitates the development of new drugs and combination therapy approaches. Conclusion. Lice are parasites that can cause serious health and social problems. Understanding the types of lice, their clinical symptoms, and effective treatment and prevention methods can help control and reduce the prevalence of these parasites. Personal and environmental hygiene practices and the use of appropriate treatments are key in combating lice. Public education and awareness also play an important role in preventing infestation with lice and reducing associated problems. Given the increasing resistance of lice to conventional drugs, further research into the development of new drugs and advanced diagnostic techniques is essential. Additionally, educational programs and increased public awareness can have a significant impact on controlling and reducing the prevalence of lice.